Governor Andy Beshear gave his daily update on the coronavirus, and here's a look at those latest statistics. There are 831 confirmed cases of the virus in Kentucky, and 6 more people have died. That brings the number of COVID-19 related deaths in the state to 37. Meanwhile, the governor has rolled out new projections showing how many people in the state could die from the coronavirus. And the number varies depending on what our mitigation efforts are going to look like going forward. Evening Edition's Mike Valenti joins us live outside the Capitol with more on what the governor had to say.
Yeah, Nancy, you'll remember earlier this week, the White House released a model projecting that even with full intervention, that's social distancing and other measures, the coronavirus could kill up to 240,000 Americans. Now, the Beshear administration took that model, they adjusted it to Kentucky and said that could mean up to 3,200 deaths in the state. And you'll remember that the governor also warned us that was an optimistic scenario and that he was going to show us more pessimistic scenarios going forward. Today, we saw those projections, which show with no interventions, 47,000 people in the state could die. But again, we already have restrictions in place, and here's where it gets even more interesting. They project that if there is a 3-month stay-at-home order, yet people do a poor job complying by that order, that could result in 13,000 deaths. With strict compliance, we could bring that number way down.
If we can keep this up, if we believe that it is our patriotic duty, our part of passing the test of humanity, to strictly follow the guidelines and the social distancing that's out there, look at that. We can save, in the very least, 11,000 people.
Again, we want to stress, as the governor says every day, this is just a projection. We don't have to accept it as fact. And in fact, he says he wants to do better than that strict compliance model, and that's why it's more important than ever to adhere to these social distancing guidelines.